back, everyone. It's great to see you. Jon and I are both ophthalmologists. Jon's my partner and colleague. We were co-residents at Albert Einstein Montefiore Medical Center. We are both fellowship trained. I'm an oculoplastic surgeon and neuro-ophthalmologist. Jon is cornea trained. We are going to talk today about subconjunctival hemorrhage. What is that?
Carl, don't forget to say where we're located.
Right. Sorry, Jon. Thank you for the reminder. I'm in
New Jersey, and Carl's in Alaska, Anchorage, Alaska. And yeah, we trained together 28 years ago, and we're making this channel to give you all this information and education about common eye conditions. Exactly.
So thank you, Jon. So subconjunctival hemorrhage is basically, why do I have blood in my eye? What happened? And, there's a difference between older folks and younger folks. But first, I'm going to show you two images, one at a time, and then we're going to talk about how Jon and I assess, diagnose, and manage these common eye problems. So if we take a look at this image here, we see an eye and we see some blood on, we call the lateral part or the temporal part of the eye next to the cornea. This is also known as the limbus. So this blood is underneath, we call the conjunctiva, between the conjunctiva and the sclera. And in young people, it's usually trauma related or contact lens related. In older people, it can be related to trauma as well, or high blood pressure, sometimes vomiting or coughing, and very importantly, anticoagulant therapy like aspirin or Eliquis or Plavix, or those types of anticoagulant or anti-bleeding medications that you would take for heart conditions. There's also a condition called hemorrhagic conjunctivitis, which is known as viral conjunctivitis, which can be very common and give you some blood underneath the conjunctiva. And these are the type of things that we see commonly. Jon, what's your take on it?
Yeah, so I see one or two patients every day that have a subconjunctival hemorrhage. In addition, we probably get another couple of calls every day about patients. So it's extremely common. And as Carl said, different age ranges, it really varies. I find the most common cause for this is what we call a Valsalva Maneuver. Now, Valsalva Maneuver is anything where you hold your breath and you get back pressure. So for example, constipation, you go to the bathroom, you feel some back pressure, coughing, sneezing, even sex. Those things where the person's kind of holding their breath. Weightlifters are always instructed when they lift weights to kind of breathe and not hold their breath, because the back pressure can sometimes cause a little blood spot in the eye like this. So the good news is, a patient calls me with this. The most important thing I always ask them is, what symptoms did you have? Because 99% of the time, the person feels nothing. They notice it either when they look in the mirror, or their relative or close one looks at them and says, "Hey, what happened to your eye? It's bleeding. You better call the doctor." And we get a call that says, "Doctor, I have blood in my eye. I'm frantic. Oh, what's happening?" But the good news is it's really just cosmetic for most people. It doesn't represent any underlying disease. Again, most people. So a lot of it's just reassurance. Now, we still will tend to have people come in because, like Carl mentioned, maybe there is an infection, or maybe there is something rubbing against the eye like an eyelash, or maybe something got in the eye and they don't even realize. But the thing is, if they're not having any symptoms, the odds are it's just a spontaneous subconjunctival hemorrhage related to some of those things. Right. And we like to bring them in because not only do we check the eye, make sure nothing is causing any irritation, but the thing is sometimes because it is elevated, it's a little bruised. Sometimes we do give them drops like lubricant drops. The other thing, like Carl mentioned, is we want to know their underlying medical status. Over the phone, we might not know those things. So when they come in and they go through a full history, we find out, hey, you're on baby aspirin every day. That can lead to thinning of the blood and spontaneous bleeding like this. Or like Carl said, they have high blood pressure. We just want to make sure, hey, is your blood pressure controlled? If it's really high, sometimes you can get this. Or they're on some other blood thinner or some underlying issue. What I always like to ask people also when they have this is, are you getting any other spontaneous bleeding or bruising in your body? So for example, if someone came in and said this to me, I have no symptoms, my vision's fine, I just noticed this cosmetically, I have this red spot. And they were coughing an hour before it happened, I feel pretty good about that. But then I still might ask them, hey, have you had any nosebleeds? Have you noticed any blood in your urine or your stool? Are you getting any spontaneous bruising in your skin? If they answer yes to any of those things, well, that's different. Then they need to go to their medical doctor and figure out, hey, maybe they have a bleeding problem, a bruising problem. But again, it's not an eye problem. So 99% of the time, if not more, it's really not their eye. It's just something that happened like the Valsalva Maneuver, or rarely it does represent some underlying issue that we need to get them into their medical doctor's office.
Right. Thank you, John. Another image showing a larger subconjunctival hemorrhage that encompasses more of the eye, the medial part. This is the nose over here, the ear on this side. So this would be a more dramatic presentation of blood between the conjunctiva and the sclera. And again, we think of trauma, we look at the patient's age. If they have frequent subconjunctival hemorrhage, that's a different picture. That's a different beast. Then we get more concerned. We send a note to the internist, the family doctor, or the cardiologist if there's a cardiac condition. What's your take on this, John?
Yeah, so I think my experience is I've seen plenty of these that look really dark and thick and elevated. I see a lot more of the other one, which is light and kind of not as elevated. I think the big difference is this person might be complaining of a foreign body sensation because it's so elevated that when they blink, they're going to feel that underneath the eyelid. So I might give them a lubricating gel or an ointment. And then I agree with Carl. I think the lighter one, which I see a lot more, I think that's more typical of like coughing or sneezing or lifting something heavy. Whereas when it's deep like this, I find more of these people are on blood thinners or they had trauma for sure.
Right.
But either one, really, it's not like you can look at it and determine what happened. The history is everything. You got to talk to your patient.
Right. But if pain is present, then, I do agree. I think lubricants are important and just reassurance. But these can take a while. They can take 2-3 weeks to go away.
Yeah. I tell people 10 to 14 days typically, kind of like a bruise. I always tell the patients, listen, this is like a bruise, but it's in your eye. Because they often want to know, what can I do to make it better? And the answer is, what would you do if you had a bruise in your arm? That's what I tell my patients. If you had a bruise in your arm, what could you do to make it go away? Right. Not much. So this is really got to clear on its own, 10 to 14 days, maybe a little longer with this such a deep one. And just reassurance. Tell them, I always tell my patients, listen, you think this looks bad, you should see the other guy.
Right. Boom. You're a beast. You're a beast. Yeah, exactly. All right. Well, listen, guys, thank you so much. Another YouTube video at Einstein Eyes, our YouTube channel. John was, again, tremendous. And we'll see you.
Like us and subscribe. We want to get you on our channel.
Subscribe, and we'll see you on the next video. Appreciate it.
Take care, guys. Bye-bye.